Hello, I'm Robert Hardesty, a board-certified plastic surgeon here in Riverside, California. Today's topic is cohesivity in breast implants. Since the introduction of the silicone implants in the 1960s, there's been rapid and progressive improvement. Like everything in life, look at your 1960s automobile and compare it to today's automobile, from safety, effectiveness, and efficiency. And with the cohesivity, a lot of the problems of the past are behind us with still the fill of silicone. We talk about generations. There's been multiple generations, and I think we're up to our 5th generation. But I'd like to talk today more about cohesivity. And what does that mean? That means the interconnection of the silicone. In the old days, if an implant would rupture, the silicone was like molasses. It would spill out slowly and had the potential of migrating to distant parts of your body. Now today we have different degrees of cohesivity. This results in the lack of the migration of silicone if they rupture. But even the jackets now, or the outer silicone shell, is much more firm and durable, to the point that these implants now are guaranteed for life. What does that mean? If there's ever a rupture, the implant companies will replace those implants for you. So let's talk about this cohesivity. What is it? Well, you go from molasses to rubber. Well, these aren't rubber. They're soft, but they're between the molasses and rubber. And we have different variations. We have 3 here. This is the Natural Inspira. It has a high cohesivity, but compared to the Soft Touch, which has more cohesivity, and on to the Inspira Cohesive, that has the highest cohesivity. Now, why do we have these choices, and what does it really mean? Well, let's demonstrate this. If a patient comes in and they want a very natural looking breast with a sag, you'll see how the implant sits. Now, with the Soft Touch or the Cohesive, that upper pole fullness is much more apparent. So ladies that would rather have a full upper pole, this is our answer. Now, we talked just a little bit about rupture and what happens with that. I'd like to demonstrate this with you. This is a brand new implant. Can't use it on a patient, but I'd like to demonstrate the cohesivity. Scalpel blade. I'm going to make a cut in it. Here's the implant. It's ruptured inside you. There's the silicone. And I'm squeezing hard. Now watch what happens. It goes back in. Very, very safe. This is the type of implant that we deal with now. Okay, now we also have different choices as we do this. And I'd like to talk about the dramatic difference in the profiles that we can give. We can go all the way from a low profile to an extra full profile. And what does that mean? You can have the same volume, but a high profile will have a narrower base width with the resultant more projection. Conversely, a low profile for the same volume will have a wider base. Well, how do we pick this out? Well, we talk with the patient, we look at their preoperative models, and we measure their chest. For instance, if you're a wide body and I put a high profile, you might not get as much cleavage. If you're narrow chested and I put a low profile, great cleavage, but implant in the armpit. So we want to pick the profile that matches your body. And now with these multiple choices that we have, we can custom order the implant for what you want, the look and the shape of your breast. Now, the gummy bear, back to that again. The gummy Natural Inspira is gummy. The Soft Touch, which is gummier, and the Inspira Cohesive is the gummiest. So now we have 15 choices, 5 different profiles, 3 different cohesive natures. And again, demonstrating how safe they are. So in closing, we have choices that we've never had before. If you like the natural breast teardrop, If you want a little bit of higher profile, or if you really wanted a round upper pull fullness, depending on your needs, your wants, and desires, we have choices. When you have choices, you can make better decisions. Thank you very much, and I hope to see you soon.